Good morning. Welcome to your program, Your Agenda here on Cignal TV's One News on channels 8 and 250. I'm your host, Cito Beltran, welcoming you on this November 10, 2023. It's a Friday. It's a last day towards the weekend. And I do hope all of you have activities lined up or are at least scheduling a day of rest. So meanwhile, please do join us today as we talk again on about interesting topics, social concerns, and agendas, people's agendas. Today, we will be talking about patients' rights, an organization that focuses on patients' rights and things you need to know, because I have been spending a lot of time learning, writing about Filipino experiences in public health, what poor or regular, ordinary Filipinos have to go through whenever they experience medical emergencies. So today, that will be our primary focus, and hopefully we'll still have time in the latter part of the program to tackle the economy. Has it been a good third quarter? Will it be a better fourth quarter? We'll try to tackle that later. But in the meantime, let's go to our daily starter for today. But before that, I have to remember to express gratitude. First of all, let's all be grateful to God Almighty that we are all healthy, that we have jobs, we have a roof over our head, we have family. Whatever it is, always find a way to be grateful. Even if you have very little in life, be grateful that you are alive, okay? There are people who are no longer with us, and let them remind us, let their memory remind us to live a life that honors them. In any case, thank you for being Cignal TV subscribers, and of course, for watching us via Facebook, YouTube, and thank you pa rin po sa PLDT Home Fiber Optic Internet. Okay, now let's go to our daily starter from best-selling author Mitch Albom. Love is how you stay alive even after you are gone. I came across this on a post by one of my uncles, one of my titos, and it really impacted me because it is the love that we give to others, the love we shared and we did for other people, that will keep us, our memory, and keep us alive in the minds of people. So it's a simple thing from Mitch Albom, but love is how you stay alive even after you are gone. Now, let's now go to the front page of the Philippine Star today. And the headline is, Sara drops request for secret funds. Vice President Sara Duterte is letting go of her request for a combined 650 million in confidential funds for the office of the Vice President and the Department of Education, saying she must move on from such a divisive issue. Okay, then at the top of the front page, seemingly good news, Philippine economy grows faster by 5.9% in the third quarter for this year, primarily driven by government spending. So, nag-uumpisa na pong gumastos ang gobyerno in different projects, outlays, etc. So, the economy improved in the third quarter, but it's still not that great compared to the previous year. And below that, new DA chief starts agency revamp. Newly appointed Agriculture Secretary Francisco Chu Laurel Jr. has started a reorganization within the Department of Agriculture, first with the appointment of his chief of staff and then calling on all of the people who were appointed, contractual appointees. He also issued a memorandum directing all employees covered by contracts of services to start vacating their offices. Kasi ganyan naman po yan, di ba? Co-terminus kayo doon sa nakaupo kung na-appoint kayo by political appointment. Meanwhile, another new barangay captain was shot dead, murdered as he boarded his tricycle in Pagadian City. So, ayun po. Okay. Meanwhile, that center photo of the Philippine Star has nothing to do with volcanoes or eruptions. They are massive cloud formations signaling the mix of cold weather and hot weather, or hot air and cold air. Baka mamaya nakikita ninyo, mag-alala kayo. Meanwhile, the National Grid Corporation hits the Energy Regulatory Commission for failure to conduct regulatory reset. Okay, the NGCP has branded as unfair the ERC's decision to disallow some of NGCP's expenses, saying the ERC should be blamed for its failure to conduct needed regulatory reset. So, yun po, we will try to contact the NGCP maybe next week if we deem that this is a point of concern, particularly for electric consumers or distributors. Meanwhile, PhilRice wants half-cup rice in dining places. To reduce rice wastage, the Agriculture Department's Philippine Rice Research Institute, or PhilRice, is pushing for a bill that will require food establishment to offer half cup of rice, a measure that President Marcos filed when he was still a senator. Nothing wrong with that. We support that because in many places you will always see there is so much food wasted, particularly rice. And in other places naman, yung iba sa inyo, kung kumain ng kanin, parang tubig. So it's not a good situation. So we support that. Meanwhile, Newport World Resorts to host Gordon Ramsay's first restaurant in the Philippines. Newport World Resorts is gearing up for the opening of one of its biggest restaurants in the property, Gordon Ramsay Bar and Grill. Para sa inyo mga foodie, that would be very interesting and something to look up to. Meanwhile, diplomatic snub, Washington's pandas head home to China. Nako po, pagtiba naman yung panda bears, na politika na. All three giant pandas in the Washington Zoo began a one-way trip back to China on Wednesday, leaving only a few of the cuddly creatures in the United States at a time of tense diplomatic relations. Okay, medyo we unfortunately can't dwell on that, but we will try to look into that story. Meanwhile, UP still Philippines best in 2024 QS Asia rankings, or Quacquarelli Simmons World University rankings. We came in as one of the best in the country. Okay. Meanwhile, last but not the least, Soler Resort Entertainment recently kicked off its holiday celebration with its annual tree lighting ceremony. So there you go. We'll go for a quick break, and when we return, we go and talk all about patients' rights here on Agenda.
The Philippine Alliance of Patient Organizations, or PAPO, is a coalition of patient groups advocating for better and more efficient access to healthcare. Some of their members include Scoliosis Philippines, the Diabetes Club, and PGH's Cancer Survivors Organization. The organization works with communities of patients, government agencies, private corporations, and other key stakeholders in health to build and strengthen patient-centered healthcare. The Alliance has three focus areas: patient rights, patient participation in health policy, and universal healthcare. In these mentioned areas, PAPO targets the rights and responsibilities of patients to participate and get their voices heard about healthcare policies and services. Let's discuss their goals in helping improving patients' welfare on today's agenda.
Karen Alparce-Villanueva is equipped with over 30 years of experience in communications and policy work in various industries such as insurance and pharmaceuticals. Last year, she was appointed as the president of Philippine Alliance of Patient Organizations, where she pursues her health advocacy. Villanueva also contributed in government work as she used to serve as a consultant to the health department and a board member of PhilHealth.
Kay haba man daw ng prosesyon, sa agenda pa rin ang landing. Thank you very much, Karen, for joining us this morning. It took a lot of effort, but we finally got you to come on board.
Thank you, Cito, and thank you to Agenda for giving us a platform to talk about what we do in PAPO.
Yeah, let's get the ball rolling. And what exactly started all of this? I mean, you came from different industries, and how did you end up working with the alliance, and what brought this alliance together? What was the seed that germinated into this organization?
So actually, one of the companies I used to work for gave a grant to an NGO called the Asia Foundation. And this foundation did a mapping of the existing patient groups and brought these patient groups together. And as a result of that capacity building of the patient groups, PAPO was formed legally in 2011. And it so happened that in 2015, I decided to take an early retirement from the pharma industry. And so we were chatting with the former president of PAPO, Fatima Garcia, Lorenzo, and her husband asked me, "So what are your plans after retirement?" I said, "I don't have any plans." And then he said, "Why don't you help Girly revive PAPO?" Because at the time, obviously, lahat naman ng NGOs, there's a problem with sustainability. And so I took up the challenge because it's also coming from personal experience. I took care of my dad who had multiple myeloma. And I knew how it felt to be a patient, how you're bombarded with so much information and you don't know where to go or what to do. And to think I was already working in the industry. And so I took that challenge and have not regretted since.
You know, when we talk of NGOs, of organizations, foundations, people tend to be, very sterile in their view of things. It's very detached. But once you start telling stories, when you share the experience, people suddenly realize, "Oy, ako din." Would you mind sharing with us just portions of your experience with your father and the health system that galvanized you into being part of this movement?
So, Cito, I noticed the great divide, in terms of information. There's actually a technical term for that, information asymmetry, meaning the doctors know so much and the patients know very little. And so that gap is so huge that it leaves you with a feeling of disempowerment. And so that's why I wanted to help patient groups. I wanted patient because Papa focuses on patient leaders, because we're an alliance of more than 50 member organizations. So we're not focused on a particular disease. We focus on cross-cutting issues, which are, as mentioned in the video, patient rights, patient participation in health policy making, and universal health care. And our aim is to really strengthen the leader. Kasi the leader sets the tone for the organization, and the leader has to be able to see ano yung mga problema at the system level, no? So for example, patient navigation. What's patient navigation? It's essentially the first problem of patients. Kanino ba ako kukonsulta? Kanino ba hospital ako pupunta? And you'll be surprised that people don't know that there's a difference between public and private hospitals. That there's a difference between primary healthcare doctors and specialists. And there are even subspecialists within the specialist category, which was a learning for me. I thought cancer doctors or oncologists are all the same, but they have specialties, and you need to consult the subspecialist in that specialist category. So things like this, and share information like many of our leaders have financing gaps. No, they can't afford treatment. So the community shares information. Sino ba nagbibigay ng guarantee letters? Sino bang mga doktor ang maayos, mabait sa pasyente? And these are small things, but they count so much. And there's really a dearth of information about these things.
Yeah, and beginning with that information asymmetry, you are so correct, because many patients in the Philippines, parang kung ano po ang sabihin nyo, gagawin ko. Especially in the poorer communities, in the public hospitals, because I pity our government hospitals. They keep getting budget cuts from politicians, and so they have to tell their patients, bili ko, operahan yung tatay nyo, humingi na kayo ng dugo sa Red Cross, or kailangan ninyo bilhin lahat ang nasa listahan, doon kayo sa butika dyan, etc. So, and the patients don't even know what's going on. The families don't dare question. Parang Diyos-Diyosan na yung mga nag-uutos sa kanila.
Totoo yan, Cito. And problema rin kasi natin yung health literacy and health-seeking behavior, no? Yung health-seeking behavior, yung pupunta pag malala na, no? Yung lack of awareness about preventive health, no? And that's why universal healthcare is very important. Kasi it puts healthcare at the tip of the fingertips of people na kumbaga they can access within their local barangay health center.
Yeah. And what have you discovered? What is the reality of healthcare in the Philippines? Because I'm a champion of public health, of healthcare. I keep talking about it in my columns. I keep featuring it. We in Agenda keep featuring it on the program. But I recently discovered itong sinasabing zero-sum balance, no balance billing ng PhilHealth. I'm sorry, but it's a lie. You go and watch the patients. They're still putting out money. They're still borrowing money. And as you pointed out, naghahanap pa sila ng patron saint sa Congress, Office of the Mayor, because there are still expenses to be paid. What are your discoveries when you took on this burden for patients' rights?
So tama ka, Cito, no? Yung no balance billing, batas yan, no? And it applies to indigent PhilHealth members. Pero tama ka, yung reality is, yung mga pasyente pa rin ang bumibili ng gamot. And that's confirmed. So, malungkot ma-realize na ganyan, pero yan ang reality. Kasi sasabihin na naubos na yung budget for the year, so there's not really enough budget, no, to fund no balance billing. And sadly, many of those who violate are government hospitals because they're mandated, diba? to ensure no balance billing. Pero hindi nga yan ang nangyayari sa ground, no? And bakit? Marami rin kasing leakages, Cito, marami ring fraud on the ground. May tinatawag na upcasing, so simple ubo-sipon, sasabihin pneumonia para mas malaki yung reimbursement. So nangyayari din yan. And then we also spend so much on dialysis. It's draining from the PhilHealth Fund. And kidney failure is caused by complications of diabetes. And is diabetes not addressed? Because nga kulang ng compliance yung mga pasyente, hindi nagpapacheck na meron na pala silang diabetes, malala na pag magpacheck. And therefore, mas malaki yung gastos. Kaya nga dapat ang strategy is yung primary healthcare na tinatawag, 'di ba? Na nagpapacheck bawat no.
And yet no one seems to be talking about it. I mean, that's why, alam mo, kung nanliligaw ako sa'yo, dapat sinagot mo na ako. We wouldn't give up. We persisted on getting you because no one is talking about this. No one is talking about primary health care. No one is talking about healthy lifestyle, etc. In PAPO, so okay, you're an alliance of organizations for fighting for patients' rights. Now, what are the key concerns of PAPO? You already said you monitor or you support leaders in the communities or in particular fields. But what are your key concerns?
Okay. Ang number one concern namin, Cito, is mag-participate kami in health policy making. Ano ba yung ibig sabihin nun? Hindi kami i-invite lang pag natapos na or nasulat yung policy, but we're invited to take part in writing and co-creating the policy. So for example, very concrete example, in PhilHealth, they develop benefits, and these benefits are approved by their board, and also they get funded. So what PAPO is advocating is PhilHealth includes the PAPO, or a patient representative, a patient leader, in crafting this benefit packages. And also, you talked about universal healthcare. Actually, there's so much about universal healthcare, but one of our recommendations to government, and particularly to PhilHealth, is to have a massive information campaign about universal healthcare. Kasi hindi siya umaabot sa tao. So maraming Pilipino hindi nga nila alam na libre na ang PhilHealth, na kailangan enrolled kasi nga may batas na which was passed since 2019 establishing universal healthcare. So 'di ba, napakasimple pero hindi pa nagagawa. So we're part, Cito, rin of an alliance called UHC Watch. So we're hoping that we can do a massive campaign kasi sobrang konting nalalaman ng mga tao about universal healthcare.
Which actually is correct because lagi ako namamasyal sa mga barangay or talking to regular Filipinos, and all the time they will tell me, "Sir, hindi ho kami nagpa-hospital." Sabi ko, bakit? Mahal ho kasi ang hospital. Nagpunta na lang kami dun sa albularyo, nagpunta na lang kami dun sa hilot, etc. And you're so correct, because they're scared of going to the hospital because it costs a lot of money.
Correct. Ideally nga, Cito, pupunta sila palagi sa barangay health center kasi magkakaroon ng consulta package ang PhilHealth. So pwede sila doon magpa-check ng BP nila, ng dugo nila, general screening, x-ray, etc., TB screening. And it's supposed to be budgeted at 700, I think the latest is 700 pesos per person. Pero yun nga, hindi pa siya naro-roll out sa lahat ng facilities kasi nga kailangan mag-enroll din yung provider. Kumbaga, kailangan yung supply meets the demand. So mababa yung demand, therefore mababa rin yung supply. Wala masyadong nag-enroll sa network. Kasi yun ang idea ng government, magkaka-network So yung from the primary health care, which is the barangay health center or the city health center, kung malala, i-refer na sa ospital para hindi na
Is this is this really should this be the responsibility of PhilHealth or dapat ba sa DILG? Kasi ang dami ko nakikitang situation that the DILG, Benhar Abalos, could actually impact so much if it became their burden and hindi yung napunta sa health providers, sa PhilHealth, etc. Meron ba ang PAPO na alliance with the DILG on this matter?
Maganda yung point mo, Cito, kasi tama ka, devolve yung healthcare. So technically, responsibility yan ng local government unit. And specified yan under the Universal Healthcare Law. So PhilHealth lang ang magpa-finance, tama ka, pero ang magpo-provide is the local government unit. So i-organize sila by city or by province, no? Dapat may parang network sila of providers. So ang challenge namin sa PAPO is actually gusto namin umupo lahat sa local health boards. Kasi nandun yung laban, di ba? Nandun yung budget, nandun yung mga programa. So yun yung dream ng PAPO na talagang magkaroon kami ng patient leader in every local health board para nandun yung boses ng pasyente. So challenge yan sa amin kasi mostly national yung organizations, Metro Manila based.
Correct.
But certainly that's in our radar and initially.
But you can get that via legislation. Don't you have legislative champions, congressman, senator, sila Pia Cayetano? I know she's a health buff. You can just have a law passed na requiring every barangay to have a patient's advocate.
Yes. Pwede talaga siya, Cito, kasi under the law also, merong parang citizen representative. Pero mas maganda nga, mas specify na patient representative in the local health board para siguradong hindi kung sino-sino lang yung a-appoint nila. Kasi tama ka, pwedeng ibang NGO who's in charge of climate change, etc. Maganda talaga focus on health. Tapos, yung ginagawa namin na capacity building ng patient leaders comes into play. Kasi, ang katwiran din namin, hindi naman kami pwede magpadala ng patient leader na walang alam sa sistema. Kailangan maalam. Hindi lang passionate, pero may alam. Naintindihan yung sistema at saka ano yung mga problema or pain points ng pasyente.
Okay. Karen, let's go for a quick break. When we return, let's cover the rest of the concerns of PAPO as far as policies and healthcare is concerned. And let's see what develops. We'll be right back here on Agenda. Okay, we're back here on agenda. I thought we were going to have a VO, but let's welcome back Karen Villanueva of PAPO, or the Patients Alliance, Philippine Alliance of Patient Organization. So, Karen, you were saying earlier that you would like, well, first, that your organization is an alliance of many organizations covering patients' rights and patient care. Now, second, your organization, PAPO, looks after or supports leaders in those areas to equip them, empower them, etc. And then you said also that the ideal is for a patient's advocate to be part of every health board at the barangay, at the municipal or at the city level, and at the provincial level. What are the other concerns of PAPO that you are working on right now?
So, Cito, one of our concerns is actually yung predictability of costs of hospital confinement. No, it has always been our advocacy that there needs to be transparency. Kumbaga, nalalaman namin kung tayo'y papasok sa ospital for a heart bypass, and we are merely I'm not talking about people in the suite because they will pay whatever is charged. I'm talking about ordinary people like you and me, you know, hirap, but we're middle class. And any major catastrophic disease, whether it's cancer or a heart bypass or a pacemaker, will make us poor. And so we've been asking, what is there a possibility that there will be a cap in these in these procedures? I know that medicine is not an exact science, but can we have an idea so we can prepare, 'di ba? Kung kailangan nating umutang na tayo, if we need to unload property, then let it be. But we need predictability. We cannot just enter a hospital with a blank check and be shocked at the
and we need to back it with logic and reason, because in my column today in the Philippine Star, I wrote there that the patient I was assisting we ended up paying 150,000 for 2 CT scans and a 2-day stay or 3-day stay in a private hospital. And when we brought him to the Rizal Medical Center, he stayed there 5 weeks, almost 6 weeks. He had major surgery, lahat ng professional fees. The total was 700,000. So parang, how do you make sense that a private hospital for 2 CT scans can charge you 150,000 and for suero, etc. So you're correct there. There's no predictability. But akala ko ba PhilHealth was supposed to fix that problem?
According to them, it's a struggle, no? It's a struggle because there's no price control naman eh. The private hospitals operate like any business, diba?
Yeah.
But since PhilHealth is the first peso that is reimbursed, they certainly have to do that, right? They have the power to do that. And I think that's already in the works. Understand they're in the process of increasing their case rates. But I said, if you're going to increase your case rates and you're not going to manage the supply side, meaning the provider, baliwala yung increase. Imbis na makatulong kayo sa pasyente, mas mahirapan yung pasyente kasi they can, the private network, the private hospitals can increase as much as they can, and there's nothing that so kumbaga dapat insurer mindset, 'di ba? Yung concept naman ng HMO, you're able to drive costs down because of volume. So dapat
what about yung mga professional fees? Because you said predictability of medical charges, procedures, etc. Ang isa pa dyan na parang hocus-pocus or I don't really know how it is established. What about professional fees? I mean, I love doctors. Marami naman akong kaibigan doctors. But pag kami nag-umpukan, talagang sabunutan na nangyayari. Kasi no one can explain how do you determine professional fees.
Okay, alam mo marami kaming kaibigan na societies kasi nga Papo gets invited yung clinical practice guidelines development at natanong ko sila basis bakit kailangan yung professional fee nyo pag naka-confine ng pasyente is based on the room rate. So ano logic yon? Why can't you base it on your actual consultation fee in the clinic? Ang explanation nila sa akin is because if the patient is confined, they're technically available 24/7 for the patient. And therefore, yan yung nakagawian nila. And
technically available but miraculous when they appear. Okay, no, because tama ka yung sinabi mong based on room rate. I mean, nagpa-check-in ako sa hospital. Sabi ko, regular room lang, okay na ako. Kahit may kasabay pa ako sa ward, wala akong pakialam. And then they put me in a suite. And I said, why are you putting me in a suite? Sir, kasi wala na ibang kwarto eh.
Correct.
So, not by choice. It wasn't my choice. It was by circumstance. So, I have to pay 3-4 times more than
Correct.
the average Juan de la Cruz.
And that's just one doctor, Cito. Alam mo naman, di ba, minamanage tayo multi-specialty team. So imagine mo, na 2.5 ang room rate mo, kung 7 yung doktor mo, magkano yan in a day? Professional fees alone. And I know there was an attempt in the past for doctors to be more transparent on their fees, but remember they raised a concern, hindi raw sila parlor para ipaskil yung mga rates. Pero everywhere else in the world, alam naman ng, doctors are transparent about their fees. So I don't understand why it needs to be different here.
Okay, kaya yan, perhaps it's timely because of the current situation regarding a case involving a doctor who died in jail. I guess all of these issues about transparency, prices, etc. This may be the right time to talk about all of these things. Now, so transparency and predictability of medical costs, etc. Representation in the health boards. What else are your concerns?
May concern din kami, Cito, for medicines in the formulary. As you know, many cancer medicines and medicines also for rare diseases, sobrang liit ng market because they're, and many of these new medicines hindi nakakaabot sa mga pasyente because there's a process now where first, there needs to be a clinical practice guideline for the particular disease. And the next step, it will be applied in the health technology assessment for cost effectiveness, cost efficiency. And that's the only time it will be included in the formulary. So
maybe you can find a team of lawyers in UP who can file a case before the Supreme Court because when I was following the cases regarding Dengvaxia, etc., I pointed out that in case nobody noticed, we disregarded the formularies, we disregarded a lot of protocols during COVID. So that is a precedent, and now it can also be used as a case in court to prove that saving lives is a greater priority than than the rigid regulatory process of proving effectivity of medicine, especially if they've been tested abroad already.
That's true, Cito. Kasi problema rin yung capacity ng mga nagre-review. We have very few health technology or health economists within government and even in the private sector. So that remains a challenge. In the meantime, patients don't have access kasi being included in the formulary is equal to access because even local governments cannot buy the medicine if it's not in the formulary. So that's so important kasi kahit mahihirap, need access to treatments that work and which have less side effects than the old treatments.
And my friends don't have to go to Shanghai, Taipei, or Vietnam to get medicines that aren't available for leukemia, etc. Okay, so Karen, unfortunately, I do know you have a prior engagement meeting, so I will release you for the moment, but you need to come back to me, sabi nga nung song, no? Because this, I really, really feel strongly about the patient's right. And we support you, we congratulate you and Papo for the work you do. And we are 100%, and let us know anytime you can come on board.
Thank you so much, Cito, and to the agenda team for this chance. Marami pa kaming gustong sabihin about the work that we do. And we'll keep you updated on the developments of how we are advocating for better access for patients and also to be able to work with other stakeholders. So in November, I'm talking to the hospital group. They've been inviting patient advocates, which is good because they're now seeing that we bring something to the table. We bring solutions.
Pakipadala na lang ako sa email ng application para makasama sa grupo ninyo. Thank you very much, Karen Villanueva, Philippine Alliance of Patients or Patient Organization. God bless you.
God bless you too.
Okay, let's now go for a quick break and we go to our next guest from Patients' Right. Let's find out, totoo ba itong nag-improve ang economy? Let's ask our economist because I am confused. We'll be right back here on Agenda.
Here's some good news for the Philippine economy. Data from the PSA, or Philippine Statistics Authority, showed the country's gross domestic product, or GDP, grew by 5.9% in the third quarter, the fastest expansion among major emerging economies in Asia. The third quarter growth is also way faster than the 4.3% recorded in the second quarter, but slower than 7.7% in the same period last year. This makes the country's economy the fastest among nations that have released third quarter data. The expansion was attributed to higher government spending in the July to September period. But elevated food inflation continued to dampen household spending, which slowed year-on-year to 5%. According to Socio-Economic Planning Secretary Arsenio Balisacan, the economy will need to grow 7.2% in the fourth quarter to achieve the low end of the government's full-year 6 to 7% target. Can the country achieve this target? Let's discuss further on today's agenda.
Leonardo Lanzona Jr. is an economics professor at the Ateneo de Manila University. He holds a doctorate in economics, which he earned from the University of the Philippines. Lanzona teaches various courses like price and allocation theory and advanced microeconomic theory.
Okay, welcome to the program, Professor Butch Lanzona, and thank you for making time for us.
Good morning, Cito, and to our viewers. Thank you for
Okay. Paki-explain nga. Nahihilo ako. Echo 11 ko lang, hindi ko pa yata pinasayon. But you know, I'll take the good news where I can get it. But people I talk to keep pointing out, Cito, all of this economic good news is not intellectually honest. Because growth is relative to the point of origin or point of reference. So, sa madaling sabi, kung tong taon lang na ito, tama na tumataas daw, lumalaki daw, o nag-i-improve yung economy, but in comparison to previous years, plus the COVID pandemic, it can be misleading. Could you explain to us, sir?
Yeah, actually may sinasabi nga na there are such things as base effects because nag-contract yung economy during the pandemic. And so we're starting at a very low point. So just a small increase would result to a significant percentage. Pero I think we've gone through that already. I think the economy has grown to such an extent na parang we're already the level is at the pre-pandemic period. So indeed, we did grow mga 5.9. No? And if you look at the sectors, each one contributed. The question here is, how sustainable is this growth? Kasi if you look at the data, the driver is government expenditures.
Yes.
I think it was a 6.7% increase, no? From a 7% contraction last quarter. But usually, if government expenditures increase, you expect consumption, investments to also increase. Parang it creates some kind of multiplier effect. And unfortunately, if you look at the data, nag-decelerate yung household spending. And then investments actually contracted by 1.6%. So it would seem na
gumastos yung government, pero siya lang.
Siya lang. Parang hindi siya aligned with the needs of the private sector. Kasi yung private sector spending has not changed significantly. Yung household consumption siguro. But it's far lower than last quarter, around 8% yata in growth. Now it's only 5%. And then if you look at private investments, it has actually gone down. So it would seem na, kasi the government has promised na they'll try to catch up, diba? Kasi they're trying to reach the lower end of their target, yung 6%. So they promise they're going to spend a lot of money. Unfortunately, I think it has crowded out the private sector. Parang na isang tabi yung private sector because of these government expenditures. And then maybe it could have also increased interest rates. Although, syempre, andyan din yung monetary policy that has already increased interest rates. But all of these government activities could have discouraged a lot of private sector spending.
Mhm.
Kasi nga they're trying to get as much resources as they can to
Okay,
reach the
so
target.
so
So
what's
ang mangyayari
happening?
nun, hindi siya sustainable. It cannot happen kasi the economy is like a big machine eh.
Mhm.
All parts should be working, di ba? If only one
Yeah.
part is mabagal yun. And then eventually, baka mag-overheat yan and everything. So that's what I'm worried about that the government is in effect crowding out the private sector.
Okay.
Actually,
Yeah.
I have no problem with government.
What type of government spending is happening? Because parang alam ko nakikipag-usap pa sila sa uutangan nila eh. And so when you
Marami
say
yata, if you
government,
look at the data, there's a lot of construction eh. So
Mhm.
most of the expenditures are really towards, infrastructure. So I think may mga program na, pero I think they're trying to push it further. And then meron din siguro mga social security, mga tipong. But still, the idea nga is that it may be affecting negatively yung private sector. I
Yeah.
have no problem with government expenditures.
Yeah.
In fact,
Yeah, but my
I
question,
would
Professor
prefer
Butch,
that kaysa walang
yeah.
growth.
Oh, pasensya ka na, Professor Butch, no? But
Yeah.
I'm just it might be the wrong question, but I'll ask it nonetheless. Okay, so the government is spending, the private investment, the companies are not investing. They get crowded out or parang
Yeah.
tinabi sila. But government spending means they're spending our money. Is
Yeah.
this the reason why we have no money left to spend for consumption?
Well, our money plus may mga loans. So to some
Ooh.
extent, may mga loans silang kinukuha. Pero
Mhm.
I think nahihirapan din sila kumuha ng loans eh. Kasi in spite of the fact na tumaas yung government expenditure, they're still parang underspending. They're not meeting, they have a certain target yung deficit spending this year. And from my reading, they're only reaching around 60% of the target. So nahihirapan na rin sila in trying to get loans. So, siguro during this quarter, talaga nag-push sila to get more, siguro, mga overseas development assistance.
Yeah.
Things like that. So,
Yeah.
pero yun nga.
Okay. So you said, okay, the concern is the consumption is down, private investment has gone down, and government might actually in its splurging or it's in performance pushing aside private sector. What would be the final outcome? Because all the economists in government are saying, oh, we are doing all right and we will achieve the bottom of our target. It will be a good year. Pero
At some point nga mag-overheat yung economy. Kasi pag hindi mo naman, if the private sector is not being affected by all of this government spending, it might lead to even more inflation. Kasi tumataas lang yung aggregate demand. But the supply is lagging. So again, you have this supply side constraints. So yun nga ang problema. Will we see the same figures in the next quarter? Yun ang issue. Of course, pwede naman sabihin, Christmas time, maraming remittances. But still, will they be able to meet yung 7.2% that they said that they will try to work out?
What is the significance of those numbers, Professor? Why? I mean, okay, it's nice to say, Mama, naka-gold ako, or nakauno ko sa aking exam, etc. But in real terms, for every Filipino, what is the significance of a 6 or a 7.7 growth in the economy? I mean, does it really improve the quality of life of us ordinary Filipinos, or pangmayaman lang yan?
Yeah. It's just growth, and therefore walang pinag-usapang distribution. In fact, tumaas yung yung spending on valuables, yung spending ng rich. So I'm also worried na baka all of this growth are just benefiting the capitalists, yung mga owners of capital. Siguro yung mga owners ng mga construction companies. So they're spending a lot in terms of luxuries and so on. So
Mhm.
parang in that case, parang this kind of growth hindi siya inclusive eh. It could possibly be polarizing.
Inclusive. I mean, it's not inclusive, it's exclusive.
It's polarizing. It's putting the people in different ends, in mga extremes. Nawawala yung middle income. Ang issue actually, I think, is that, well, I'm in favor of government expenditure, especially today. No? We're facing a slowdown, especially in the global economy.
Yeah.
But I think we really need a good plan. Kasi parang the plan has to be in such a way na the private sector should be at the forefront of the economic activity. You cannot let just the government,
Mhm.
do all the spending and do everything.
Mhm.
Parang you have to make sure that the private sector participates in the economic process.
And it's
Otherwise,
not just
gonna work,
about it's not just about growing the economy. It has
Yeah.
to be, as you correctly pointed out, towards an ultimate goal. What is our
Yeah.
intention? Attract more investments? Is
Yeah.
it to create better educated
Yeah.
Filipinos, etc.? So I
And I'm also
suppose
concerned about they're harping na it's the fastest growing in Asia. Pero we're starting at a very low, di ba? At a very low level. Kaya yung mga Singapore, mga 2%. Siguro Thailand,
Oh.
3%. Pero ang tax lang, yung 3% nila is much higher than the 5.9% that we're growing. So,
yung parang tayo,
it's not comparable eh.
tayo 1,000, yung Singapore, Japan, billions.
Oh, parang ganon.
Ay.
Although they're saying yung mga investors daw, they're looking at growth rather than the actual level. Pero you still don't see a lot of investments. In fact, nag-contract pa nga yung investments. So
Okay.
people
Well,
apparently
Professor,
are not convinced.
Professor Butch, I will probably be calling on you again as we watch this situation because it's very revealing. One thing that was never discussed in any of these proclamations is that the private investments in development construction has contracted, and you're the only one who mentioned that. So
No,
that alone
not in
is good.
infrastructure. Yeah. Not in the infrastructure, but yung mga factories.
Factories,
yung mga
yeah.
inventories,
Okay. Okay. Thank you very much, Professor Lanzona, and God bless you, sir.
Thank you.
Have a great weekend. Okay, that's
thank you.
Professor
Bye-bye.
Leonardo Butch Lanzona of Professor Economics at the Ateneo de Manila University. And let's go for our final blessing for the week from the book of Nehemiah, chapter 8, verse 10. Then he said to them, "Go your way, eat the fat, and drink sweet wine, and send portions to anyone who has nothing ready. For this day is holy to our Lord, and do not be grieved, for the joy of the Lord is your strength." Thank you very much for joining us this week. Thank you for those of you who prayed for the improvement of my health. I'm feeling much better. And thank you for praying for Team Agenda. Please keep it here on One News, and God bless all of you.